Carly. Thank
Hi.
you for sitting down with us today to answer some questions about your son, Blake. What happened to Blake to bring you into our office?
Well, Blake is 8 years old now, and he was born premature, and he had torticollis on the right-hand side of his neck. And we've been doing physical therapy up until he was about 3 years old. We thought everything was fine. But then he started having migraines, which broke my heart that at 3 to have migraines. But we haven't had much success. He's 8 now, it's been 5 years. We've been through 4 neurologists. I've had to take him to the emergency room because he gets so sick. He gets nauseated. He's light sensitive. He can't move. He's down for like 3 days. And now he's at the point where he couldn't go to school. So out of 5 days, he's going to school 1 or maybe 2 days. And it's been awful. We couldn't have normal activity. And I have other kids, and it just stopped the whole family. The whole family is affected by it. And we finally found, I just went to Children's Hospital about 3 months ago, and I found a new neurologist. And she recommended we come see Dr. Jacob. And she thought that, you know what, I think this might be physical. We've taken all types of B supplements and all types of things that doctors have asked us. We've been to the chiropractor, we've done acupuncture, we've done acupressure. And we saw Dr. Jacobs. And the first day I came in here, Blake was throwing up. He was sick. And I was telling Dr. Jacob I'm headed to the hospital. And Dr. Jacob saw him immediately. And he started feeling better that same day. After that appointment, I'm actually going to start to cry. That same day, he started feeling better. And you know, he's been feeling better since. Right now, we've been seeing him regularly. And right now, he hasn't had any headaches. Hasn't had any headaches or migraines. It's probably been about 2 weeks. And he's in soccer. He's in soccer 2 times a week. He's in swimming. We've had swim parties, and he's able to have. I'm sorry, I'm crying. He's able to have a normal life, and so the rest of my family. So, just very thankful. Sorry, Esther.
No, that's great to hear. On a scale of 0 to 10, 0 being no pain and 10 being emergency room, what kind of pain was Blake in when you first brought him to see Dr. Jacobs?
He was in the emergency room. We were headed to the emergency room. He was throwing up, and I couldn't get it to stop. And I had called Dr. Jacobs because the neurologist had told me to call him. I hadn't called him. And you all saw us immediately and said, bring him in right now. And I said we were headed there. We had been there before, and they gave him medicine that gave him a tick. So for like 4 days after we left the hospital, my little boy had a tick. And they basically said, you know, good luck and go back to your neurologist. And that was our regular routine. I'd try and give him as much Imodium or whatever he needed to keep him going. And then we end up at the emergency room. It was a cycle.
And how much pain is Blake in now?
Blake is pain-free. His range of motion still needs to be improved, and Dr. Jacobs is working on that. He has us doing exercises so that he can turn his neck fully to the right or fully to the left. But as far as pain, he's pain-free. He's playing. He's a normal little boy now.
And how many treatments of ASTR has Blake had with Dr. Jacobs?
I think we've had about 11 appointments.
And how many ASTR treatments did it take before Blake was feeling relief?
He felt relief the first day. He was throwing up. He was really sick that very first day we came in, and I thought I might still have to take him to the hospital. But by the time he got through seeing Dr. Jacobs, we didn't have to go to Children's Hospital. He was able to go home and go to sleep and feel better the next day.
That's great.
And by the way, I want to say, and Dr. Jacobs was nice. He's done something no other doctors have done. He called the next day to see how was he doing. And we've seen a lot of specialists, and not everyone does that. He took the time, and that really mattered, and it showed that he really cared.
Yeah. And what is your impression of ASTR? What do you think about it?
I just got my first treatment because I also have migraines. And so I just got my first treatment, and I feel better. So I can imagine how Blake feels. I think it works. At least my little boy is feeling better, and I feel better after just one treatment right now.
Thank you so much for answering these questions.
Oh, thank you.
Really appreciate it.
Thank you.